Introduction to the healthcare system. Hospitals, clinic, and community health agencies can be very different from other work environments. Healthcare systems are complex, and there are many things you need to know about types of hospital systems, patient care, insurance, healthcare providers, and legal issues. This will help you learn basic healthcare concepts so you can be successful and understand the system. You need to know about the healthcare system so you can be effective. The image below shows the different groups you will be working with. As you work with the healthcare team, you will need to know about hospital systems, types of care, and the roles of each member of the healthcare team. As you work with patients, you will need to understand different types of insurance, how to help uninsured patients, and how to protect patients' rights and privacy. You will also need to know what community resources are available and how to access those services for patients. There are several aspects of the healthcare system, including hospital systems, types of patient care, and public health programs. A hospital system is a group of hospitals or facilities that work together to deliver services to their communities. Different types of hospital systems have different types of ownership and financial goals. Types of hospital systems include public hospitals. Public hospitals are funded and owned by local, state, or federal governments and receive money from the government. Some public hospitals are associated with medical schools. Non-profit hospitals. Non-profit hospitals are often community hospitals and may be linked with a religious denomination. The main goal of a non-profit hospital is to provide service to the community. Private hospitals. Private hospitals are owned by investors. Their goal is to earn a profit. Private hospitals tend to offer more profitable services such as rehabilitation, elective or plastic surgery, or cardiology. They try to avoid unprofitable services such as emergency medicine, which can lose money due to uninsured patients. There are several types of patient care, depending on their need. Types of patient care are primary care, specialty care, emergency care, urgent care, long-term care, hospice care, and mental health care. Health insurance. Health insurance definitions. Claim is a request for payment submitted by the doctor or hospital to the health insurer. A co-payment or copay is a fixed amount a patient pays for a doctor's visit or for prescription medication. For example, if the copay is $20 for doctor visits and prescription, the patient pays $20 each time they see the doctor. They also pay $20 for each prescription drug they get or refill. The insurance company also pays the provider. The amount they pay is negotiated under a contract. Deductible. The amount a patient pays each year before the insurance company starts covering costs. For example, if the deductible is $1,000, the patient must pay all medical expenses up to $1,000 each year before the insurance company begins to pay their portion. Premium. The amount paid for insurance each month. Primary care provider. The primary care doctor who a patient goes to first. Primary care providers oversee a patient's general health care. Referral. Permission given by a doctor for a patient to see a specialist. Healthcare is expensive. Even diagnosing and treating a short-term illness can cost thousands of dollars. Health insurance is a way to spread out the cost of healthcare among a group of people. The premiums we pay each month create a pool of money, so when someone in the group is sick or injured, money from the pool pays for their healthcare. Some people pay in more than they ever use. Some of us get back more than we pay in. Why is insurance so expensive? Insurance is expensive because healthcare costs are high. With high healthcare costs, the pool of money needs to be big enough to cover costs when people get sick. The pool of money also needs to be big enough to cover those without health insurance or those who get healthcare at a reduced cost. The Patient Protection and Affordable Care Act is a response to the urgent need to improve healthcare access, quality, and costs. The main goal of healthcare reform is to protect consumers, make healthcare affordable, and hold insurance companies accountable. Contain costs of private insurance and public programs. Reduce Medicare and Medicaid waste, fraud, and abuse. Expand coverage to the uninsured. Healthcare costs are paid for and by private payers or public payers. Private payers are insurance companies and public payers are federal or state governments. Private payer is a private insurance company. There are many private insurance companies in the U.S. Each company offers different types of plans that must meet or exceed basic standards set by the state and federal government. Health insurance plans can vary. Generally, lower-cost healthcare plans give patients fewer choices in doctors and hospitals. Lower-cost plans may also make it more difficult for patients to see a specialist. Types of health plans include a health maintenance organization, or HMO, a preferred provider organization, or PPO, point of service, or POS, fee-for-service, which is FFS, and a high-deductible health plan. An important difference is that some insurance plans allow patients to see a specialist anytime. For example, if a patient has a rash, they can go directly to a dermatologist. If they have an allergy, they can go directly to an allergist. Other insurance plans require patients to see their primary care doctor first and then get a referral to see a specialist. A public payer is the federal or state government. There are several types of publicly funded insurance: Medicare, Medicaid, and the Children's Health Insurance Program, and the Veterans Administration. Publicly funded health insurance helps people with low income who cannot afford private insurance. However, there are still many people who are not eligible for the programs. Other people have barriers that keep them from accessing public health insurance. For example, many people cannot afford private insurance, but their income is too high to qualify for public programs. Others are eligible but do not have information about the programs or may be confused by the application process. Others fear that applying for programs will affect their immigration to the U.S. Some uninsured patients get help paying for healthcare from public programs. Many public hospitals have financial counselors to see if patients are eligible for public programs or income-based discounts. When they meet with financial counselors, patients need to show documents related to their income, expenses, number of family members, and housing status. A U.S. law called the Emergency Medical Treatment and Active Labor Act states that hospitals and ambulance services must provide care to stabilize anyone who needs emergency care, regardless of their ability to pay. Hospitals must write off these unpaid medical bills as charity or business loss. As a result, some hospitals are closing emergency rooms, even though there is a rising need for emergency care. Other hospitals offset the cost by charging more for other medical services. This drives the cost of healthcare up for everyone.